All right, there's still people coming in, but I guess we can slowly get started. I'm delighted that you could all join us today, this afternoon, for our Planetary Health dialogue on governance of climate change and health. My name is Dorothea Baltrux. I'm the head of research and policy at the Center for Planetary Health Policy here in Berlin. And I will moderate the session today. We've got about an hour together. And yeah, I'm really happy that you're all here. First of all, a few words about CPHP. For those of you who don't know us, we are an independent think tank associated with the German Alliance on Climate Change and Health, short KLUG, which is an NGO working exactly on this nexus of climate change and health. And we as a think tank at CPHP focus primarily on the political and legal kind of frameworks that enable planetary health to thrive. Today we have our Planetary Health Dialogue, our webinar edition for September. So this webinar format we do once a month, and we always have kind of a similar format. We have 2 guests or 3 guests today actually, where we discuss a topic that we work on that we find interesting and relevant and want to discuss with all of you. And I just want to say a few words about the agenda and housekeeping. As I mentioned, we've got an hour together. We've got 3 inputs from our 3 excellent speakers with us today. And the event will be recorded and it will be made available afterwards as a video. We want this format to be interactive. It's called a dialogue, and that's what we want it to be. So after our inputs, there will be plenty of time for questions from the audience. You can put them in the chat as we go along, actually, and we'll pick them up later in the discussion. But you can also raise your hand later on and put on your video if you wish to speak and contribute a question or a thought on what's been discussed. Whilst we have our inputs and when you're not speaking, I would ask you to turn your mic off. So without further ado, let's get to our current topic. Today we want to talk about governance structures for health and climate change and how they can be assessed in terms of their strengths and weaknesses, also in comparison between countries. A very interesting topic, I think, not an easy topic. I think anyone who's worked on governance knows it's quite difficult to really make it tangible. And I'm delighted that we'll hear more about a project today that has tried to do exactly that, and where we have very new findings coming out. And we have 3 guests with us today. One of them is Dr. Karin Geffert from the Ludwig-Maximilians University in Munich. One is Anne-Kathrin von der Haar, my colleague here at CPHP. And then we have Melvine Otieno, who is currently a PhD student at Martin Luther University in Halle-Saale, and is also one of the founders of the Planetary Health Eastern African Hub. I'll tell you a bit more about all 3 of them before each of them has their input, and I'll start with Karin because the first input will come from her. So Karin is a researcher working at the LMU Munich. She has a background in medicine and public health, and her research focuses on sustainability and public health systems. Besides academia, her work experience spans non-governmental organizations and health authorities at the local, federal, and international levels. Karin, I'm looking forward to your input. Thank you for being here.
Thank you very much for this kind introduction. I'm very delighted to be with you today. I'm going to share my screen. I first need to check if you can see the presentation mode.
Yes, we can. Yeah.
Great. Thank you very much. So I just need to move. Yeah. So I'm very glad to speak to you today on assessment of governance structures for climate change and health, an exploratory approach through the PHONIC project. We just have a very short time frame, so we agreed that I will give a brief introduction and some insights about the methodological approach that we took for the PHONIC project, and also give you some background information for the project, but not a very strict research-oriented article So if you're more interested about the methodological parts, we can discuss this, of course, later. The term governance is widely used, and there's a broad agreement that governance is very important for health systems, planning and organization. But despite this agreement on the importance, there's an interesting discrepancy in the understanding and application of the term governance, and depending on who you ask, there can be many different understandings regarding actors, structures, or processes to look at. So the image generator by OpenAI, for example, gave me this very nice picture when I asked how to best symbolize governance, stating, here's a symbolic representation of governance incorporating elements like justice, leadership, and authority. I think this impressive yet slightly insignificant picture is a good representation on where we started off with our project nearly 2 years ago. So we knew that governance is a relevant factor for successful implementation of climate change and health measures. However, we were not sure how broad or narrow governance should and could have been defined for this project. Fortunately, there are many smart people and organizations who have worked on health governance before and whose experience we built on with our work. Here you can see the WHO definition for health system governance from their website, stating, health system governance refers to the processes, structures, and institutions that are in place to oversee and manage a country's healthcare system. It manages the relationships between different actors and stakeholders involved in the healthcare, including government agencies, healthcare providers, patients and their families, people and communities, civil society organizations, and private sector entities. This is already a bit clearer than the picture before, but still very broad. And the question still remains, how can we analyze governance structures and identify strengths and weaknesses to inform improvement actions? So for our project, we focused because a focus was needed to make it a bit more tangible. So we focus on government agencies, in particular the health sector, and the processes, structures, and institutions. As a theoretical framework for the start of our work, we used the WHO framework, operational framework for building climate resilient and low carbon health system that was launched in November last year. And it has 10 domains. I hope you can see it large enough, but the violet, the purple domain at the top is climate transformative leadership and governance. And in this document that was published, WHO also provides a list of so-called sample measurable outputs or indicators across 3 objectives. So overall, there were 18 of these. And we took these indicators and had many discussion rounds with our research team, but also with stakeholders from the local and the national and international level on climate change and health, and adapted these. Because at the time when the document was published, these indicators were also some of them were more outputs. So we really wanted to make them as clear and concise as possible, and also so that it could be used for our project. So we came in the end to 11, we call it global indicators. Global because these indicators are general indicators that we identified and adapted, which then need to be adapted to national context. So for piloting the indicators for governance structures, we used an approach that was informed by a methodology from the Healthy Food Environment and Policy Index, short FoodEpi. This is a methodological tool to assess policies and infrastructures for healthy food environments, and it has been applied in more than 40 countries worldwide to assess the food environments in certain countries. So it's very close to that, but we also adapted them a bit. And the piloting has overall 5 steps. So first, in a country, an expert group is built on climate change and health, as our focus and the piloting was on the governance domain, also experts with particular experience on this topic. Then second, these global indicators that I showed before had to be adapted to indicators that fit to the national context. My colleagues will going to explain a bit in a second what this actually means. But as we know that healthcare systems differ from one country to another, this is a very important step in order to make these indicators appropriate. Then third, in the situation analysis for each of this indicator is carried out to map what information is available on this indicator in a country. This was done by desk reviews and we also had some inputs from our expert during a validation process in order to add information that was not publicly available. As a fourth step, the benchmarking exercise was conducted where the indicators and international good practice examples were compared against the status quo in a country. I'm going to show you in the next slide how this looked like so you can get a clearer idea on how this could look like. And then fifth, the prioritizing actions for improvement is an important step where based on the benchmarking, the expert group can see where the level of implementation was rated higher or lower. And then based on this could inform a rating for improvement action. As said before, I'm going to give you a brief example on how the benchmarking looks like. The wording here is adapted for the presentation purpose, so it differs slightly. So we have one indicator, for example, indicator 1.1, stating there's a person or team working on climate change and health within the Ministry of Health or the relevant health authority. Then we have a good practice example. I'm not going to read it out because time is very short, but just very briefly, that in Australia, the Ministry of Health has its own department for environment and health and climate change, and much more information on it. Then on the other side, we have the situation in Germany, also a bit shortened here, but just to start off, in Germany, the Federal Ministry of Health has a department, Environmental Health Protection, Climate and Health, in Division Public Health, and at the level of the subordinate authorities, corresponding individuals can be identified in some cases, and then giving examples on where these individuals can be identified and where not. And these two are then compared. So the indicator and the good practice example against the situation, and the experts were asked, how do you rate the status of implementation according to a 5-point Likert scale? The outcomes of this assessment exercise are, for one, we are able, or the research team is able to produce a country-specific evidence report. Here's a picture of the evidence report for Germany that will be launched very soon. It gives very comprehensive information on the findings that were conducted. Then second, a policy brief based on this benchmarking exercise showing which areas showed, according to the expert, high level of implementation and which areas showed rather low level of implementation and possible conclusions that can be drawn from it. And it also is very interesting for the networking aspect within the expert group. We had a lot of methodological lessons learned, and just very briefly focus on 3 areas before I conclude. So we always had to balance comprehensiveness versus pragmatism, what is possible to do, but still try to keep it as comprehensive as possible. So we had a focus on the healthcare system and limited coverage of the environmental process. The international framework only partially represents the national structures, and the methodological approach requires many resources from the participating experts. We also think that it's important to critically reflect on a couple of points. For example, the identification of the good practice examples, the setup of the expert panel, but also the positioning of the research group. But as an outlook, we think that this approach is very participatory, and also with this explorative nature really has a very high learning potential. And it would be also of interest to extend this to other domains of the framework for a more comprehensive picture. And lastly, this work was done as part of the PHONIC project, which was funded by the Federal Ministry of Education and Research with the German Alliance for Global Health Research, GLORA. And we would like to thank the whole project team and our Phonic Advisory Board, but in particular also the participating experts who made their knowledge and time available to support these projects. With this, I conclude. I'm looking forward to the discussion.
Thank you so much, Karin. I think that was a really excellent introduction to the topic and to your project, which really I think is a very relevant one also internationally. And just because a few people joined late, I just want to reiterate, we've got 3 short inputs, the first of which you've already heard from Karin on the project, on the Phonic project, and then we will have time for discussion afterwards. And you can already put your questions in the chat if you want to, but you can also, after the inputs are all done, you can also raise your hand and join the discussion that way. But now we come to our second speaker, my colleague Ann-Kathrin van der Haar, who is a research associate at the Center for Planetary Health Policy. She is a trained medical assistant and holds both a bachelor's and a master's degree in public health. As part of her work at CPHP, she is part of the Phonic project that you've already heard about, and she was responsible for piloting the indicator set in Germany. So Anka, you will tell us more about what you found for Germany. Over to you.
Absolutely. Thank you so much for the introduction. Also, thanks to Karin for the great introduction to the Phonic project in general. So in the next 5 minutes, as announced, I'm very happy to share some general observations from the pilot process of the indicator set that we made in Germany. And for this, it's important for me to emphasize again that these are preliminary results and findings of the Phonic project. As the final analysis is still undergoing, but nevertheless, we really believe that our experiences can already have a value for other initiatives and work, and we look very much forward to discuss them with you all later. So firstly, I would like to start with a brief impression of a few challenges and lessons learned in regard to the application of the indicators in Germany. And as Karin explained in the introduction, the general aim of the indicator set was really to have something that is applicable at a global scale in different contexts and countries. And that's also the reason why we choose to pilot the indicators in 2 very different countries, Germany and Kenya, as of course the structures of their healthcare systems obviously differ greatly. I think most of you is quite aware of that. And therefore, it was, as Karin stated already, particularly challenging to formulate the indicators in such a way that it's applicable as applicable as possible and to the different contexts, but at the same time specific enough to be meaningful. And this, I call it, area of tension was also clearly evident in the German context, because the healthcare system in Germany, most of you might know, is not organized in a quite centralized way, but rather strongly characterized by federal structures and self-administration. And therefore, it was not always possible to really reflect these special and specific structures with the selected indicators that we piloted for assessing climate change and health governance structures. And as an example, we had one indicator assessing commitments for climate neutrality in the health sector, where we actually found that there was quite a lot of initiatives ongoing by non-state actors, for example, but no strategy or high-level commitment from the government yet. And in some other cases where we saw that there is like a really specific context in Germany, and we have iteratively also adapted our approach over the course of the piloting in Germany a little bit. For example, to be able to map the, in part, widely varying implementation of the indicators in the different federal states in Germany, we decided during the project to also exemplarily analyze the governance structures for 2 federal states in our situation analysis and the evidence report that will come out soon. Secondly, I also want to give you a short overview of the observations that we made in regard to the assessment of the strengths and weaknesses of climate change and health governance structures in Germany. And when analyzing and evaluating and also validating these structures, with the experts, we saw a tendency of a few gaps that were revealed. So in particular, in the area of evidence-informed policymaking, as well as strengthening further evidence generating, including instruments such as health impact assessments and environment impact assessments, but also vulnerability and adaptation assessments. We really saw that experts rated those particular indicators quite poorly, and that there are a few gaps that should be tackled for the German context. And furthermore, we also observed that clearly defined goals to transition the health system to low carbon or net zero emissions are missing, and also mechanisms to monitor and report that process are still undergoing in the German context. And in general, in the discussion with the experts, however, it also became very clear that for all of the gaps that we identified, sufficient funding and financing, as well as a really strong national strategy and supporting of implementing actors by a coherent intersectoral legislation in the area of climate change and health is needed for the German context, as this is really a fundamental condition for building a strong governance structure. And that was something that was opened up by the expert several times, no matter for which particular indicator we were trying to assess the current status. And yeah, I think I'll leave it with this here, and let's get over to the Kenyan context, and we'll hear more about the German context later, I'm sure.
Great. Thank you so much, Anka. I think that gave us some very good insights. And just because there was a question in the chat, Anka did not have slides. Karin did. There was also a question about the indicators. Maybe we can come back to that in the discussion at the beginning, kind of reiterate the indicators. But firstly, let's move over to Kenya, to Melvine. As I already mentioned, Melvine is the founder of the Planetary Health Eastern African Hub, where she supports the PHONIC project by piloting the indicator set in Kenya. She has a master's degree in environmental health and is currently pursuing her PhD in global health at the Martin Luther University in Halle, Saale. Melvine, I'm looking forward to hearing about your impressions from Kenya.
Thank you so much, Dorothea, for this warm introduction. And hi, everyone. As I've been introduced, I'll be presenting on behalf of the PHONIC project on the Kenyan side. So for us, we realize that, as we all know, that human health has been affected adversely by climate change impact in Kenya, and the country has a high degree of risk for climate-sensitive infectious diseases and also the vector-borne disease. And we know that the Kenya's ecosystem constitution has set up a renewed structure of public administration with one national government, which is also mandated to make policy on climate change. And we have 47 county governments representing who are assigned to fulfill actions addressing climate change. But we also see that the national governance approach to climate change can be consistent with the national strategy's interests, while also linking with the global and regional approaches. So through the ongoing PHONIC project, there are some of the lessons that we were able to learn when we tackled and had our workshop. And we realized that one of the lessons learned during this whole process was that we had experiences as far as discrepancy between governmental commitments and actual implementation, because we realized that there is a Climate Change Act that is of 2016 that provides that every state department has a climate change unit. But in this case, we realized that the Ministry of Health has the strategy to address issues of climate change and health, and a team working on this topic on action plan has been developed. So we realized that there is also a policy coherence across sectors that was also lacking when we had this workshop. And another thing that we realized or lesson learned is the perception of governance structure varied greatly in some cases between the non-state actors and the state actors. And this was really highly talked about during our sessions. And also there was lack of more information concerning the health-centric nature, especially with the actions that are made in one sector, but also not visible in the other. So we needed like representation from all the 43 counties to be represented. So we needed an ecosystem-wide approach that was really needed. And also in another indicator, we realized that there is a technical working group where also members of other departments were participating. And at this point, the level of collaboration was questioned because based on the participants' discussion, it was like so limited, and transparency of this participation in the governmental processes were perceived to be sufficient. And we also realized that there was need to activate existing vertical and also horizontal coordination structures by empowering these intergovernmental committees, as well as the coordinations of the climate through several plans, and especially when we talk about the budget, because there is a lot to be, a lot of the outcomes to be improved in terms of contributing to achieve this Kenya's goal as far as climate change is concerned. And also we realized that there is a need for an alignment between the Kenya's national long-term development vision with its climate change strategy at appropriate scales for implementation, and also when we talk about the green economic growth. So we see that implementation should also phase out high emission practices and subsidize the scaling up of alternative low emission pathways in parallel. So in the process, we were able also to get lessons learned from other international and regional good practice that we were able to narrow down for the participants or the stakeholders who are involved to really share their good practices that is happening in Kenya. And when we talk about also, let me just highlight quickly, when we talk about the vulnerability and also the adaptation and assessment, we see that there was less contribution that are happening at these levels, because in Kenya we have a different weather, as in structures, like in some cases, some places are semi-arid where others are completely deserted. So it was like the most vulnerable communities were not really included in this discussion. So we see that there is need for the national climate change strategy to place a quality of life for these communities as well. I will just stop at here so that we can dive deeper to other questions that the coordinator has. Thanks a lot.
Thank you so much, Melvine, for giving us an insight into some of the key findings from Kenya. We have prepared a few questions, but there are also a few that have come in the chat already, and I want to start addressing some of them. One Anka has already answered, which is when the country profile will be published. So the evidence report that was talked about will be published both in English and German on the 10th of October. But maybe one of you can also say a bit more about the other outputs that you will publish in the coming months. Maybe Karin, I can give over to you.
I can start and maybe the others can add. So we are working on the country profiles, as said before. So these will be published as a first result. We are also working parallel on the policy briefs and research articles. So we are planning to launch the policy briefs hopefully this year. We are planning for November, but we all know what can sometimes happen. So this is a tentatively date. And the research articles will undergo a thorough review. So we expect this to be published probably next year. But if possible, we might also consider some kind of pre-publishing. I might also answer to the other question on the indicators. So I will just briefly describe them, even though this will not represent the level of detail that is necessary to develop these, but just to give you an idea, I think that's a very fair question. So we had two broad areas. One is governance, where we had 3 indicators. For example, the one I showed before with a person working on climate change and health within the Ministry of Health. Second, working groups established between the ministries. And then third, exchange platform within ministries and other actors, non-governmental actors mainly. And then the second larger domain is on policy and strategy development with indicators on, for example, a national strategy for climate change and health, national health sector commitment to transition to net zero, use of evidence that was said before, use of vulnerability assessment and policy development, health impact assessment and environmental impact assessment, and also transparency and level of inclusion of non-governmental actors in policy development processes. So just to give you an idea on how broad these all were, I also want to just briefly comment that we also noticed that some experts recommended to even make it more broader, and for example, add also the area of financing there. You can hear it's currently not covered. We follow here the WHO framework, which has financing as a separate domain. And we also need to acknowledge that within the expert group, there was no person with an explicit financing expertise. So this would need really to have a different perspective to be included for the assessment.
Great.
Maybe,
Thank you for... Sorry,
maybe
Anka.
one, no worries. Just maybe one add-on, because I guess people are interested when to get the indicators, not only narratively, but also like in detail. And so the indicators are part of the evidence report that will be published. And you can at least find the version that we used for piloting. Of course, we adapted them after piloting a little bit, and that will be also part of the scientific articles that will be published probably next year. So stay tuned for October 10th to get a first glimpse of how the indicators looked like that we used for the piloting.
Great, thank you so much. Yes, keep your questions coming. As I said before, you can either post them in the chat or you can also raise your hand and come in. Maybe I will come in with one question now. Obviously, measuring governance is always very difficult, and comparing governance structures between countries, especially countries that are very different, is very, very difficult. So I'm wondering what your main lessons learned are from kind of applying this international framework, and what you found particularly surprising in applying this to your context. So maybe Melvine or Anka, you have some insights.
Maybe I can start.
Mm-hmm.
Yeah, thank you so much for that question. I feel like one of the lessons learned when we are trying to apply this international framework is having to undergo these steps from piloting of these indicators, and also because there were 3 of them, it was much easier towards the end when we had to use the best practice examples from other regions so that it can be applicable to our participants, for instance, in Kenya. And also it made it easier also, for instance, also to get more tangible points from the participants, especially when we talked about, for example, the health sector commitment, which with a clearly defined goals to transition for the healthcare system. It was really clear that Kenya has made a strong commitment at COP26, but it was difficult for them to upload these efforts in the Kenya. So through the funding project, we were able to learn these ideas also, and also mostly in terms of mitigation, because the majority of them say that there is no funding for mitigation actions, yet we need all the 47 counties to be accountable, and also work in harmony together. So that's from my end. Thanks.
Thank you.
Thank
Anka,
you very much. Yes, I might continue with a quite personal lessons learned to that regard, because what I really learned is how hard it is to measure governance, and that I'm still struggling with finding a good definition for me and a good definition or way on to like capture the whole variety that governance brings. And I struggled a bit with the fluffiness of it all when like having this methodological approach that was quite iterative and that we adapted a couple of times within the process. And I really had to learn that it's okay and that it's part of the process to really have an explorative approach that you can try to adapt and be flexible in applying to different countries. I think that's something that I really took with me in that work. Yeah.
Yeah, makes sense. And coming to the kind of more concrete measures, what would be your kind of top 3 governance measures that you were able to prioritize following the workshops that you held in Kenya and Germany? Melvine, what would be your top 3 governance measures that would be most urgent or most effective?
I think one of them will be like this need for them to work together on the climate change and health issues, especially within the health ministry and also responsible health agency. For us, it was like more clear that the Ministry of Health are also already strategizing on working with other stakeholders. And also the other one was on the teams or the units that are supporting the climate change and health at national and subnational levels, especially that are designated within the ministries. We realized that there was the level of collaboration was questioned because it was like more of people who know each other are the ones who are involved. But in this case, there was high need for teamwork, you know. And when also we talk about, lastly, when we talk about the vulnerabilities and also the health inequities, there were need for it to be streamlined across the country because some strategies were already have been developed, but their implementation was challenging due to limited resources and capacity. So there was high urge for capacity building across all the 43 counties. So those were some of the 3 major things we wanted to focus on the governance. Okay.
Great. Anka, what would be your top 3 for Germany?
That's so easy to make it a top 3, but I think I've mentioned the top 3 already in my input a little bit. So what we really saw as lacking topics after doing the piloting was first of all the evidence-informed policy making and evidence generation in the area of climate change and health that needs to be strengthened. Secondly, we saw that there are no clearly defined goals to transition the health system to low carbon or net zero emissions yet. So that's something which needs to be tackled. And thirdly, and that's probably the most important of the top 3, is that it really needs a coherent legal structure that enables climate change and health measures across all sectors. And that means that we need adequate funding, but also structures that really enable the implementing institutions and stakeholders that are part of the whole process.
That makes sense. Yeah. Thank you. A few more questions or comments have come in. So one relates to the involvement of non-governmental actors. That was one of your indicators, and the kind of regular exchanges between government and non-governmental actors. And there was a comment here that also non-health sector actors should be included. Was that part of your indicators? And if not, why not? Maybe Karin, that's one of a question for you.
Yeah, it's a broad question because it addresses, from my perspective, two areas. One is the engagement of governments with non-governmental actors, and then health with environmental and other actors. So maybe starting with the first one, we saw, for our project, we started off saying that we look really at government measures and also their interaction with non-governmental actors. So, for example, when looking at at funding opportunities, really considering, for example, for Germany, that the Ministry of Health cannot directly fund something, but is rather providing an enabling environment in that way. This is a specific perspective on the German healthcare system, and it shows a lens on some areas, but it leaves out other areas. And I think that's something that needs to be done if you really want to get a very comprehensive picture. Regarding also the other sectors, I think this is partially covered, and yes, we all agreed that it was important. And I think what was really also interesting to us is that we tried to set a focus to keep it manageable, but we kept getting comments on we should have a more health in and for all policies perspective. And if we talk about health and climate change, we cannot leave out the environmental sector. And we acknowledge that this is really a limitation of the process. Nevertheless, it's, as I said before, trying to find a balance. And the exact indicator on engagement is not leveled to health actors. So I think this is represented there as well.
Yeah, excellent. Thank you. And then there was a question. Obviously, the German and Kenyan health systems are probably quite different. You already mentioned that a little bit. Did you find any similarities regarding governance, or what were your main differences, Melvine, Anka?
Maybe I can start. Concerning the similarities, there was lack of appropriate measurements in all levels, because, for instance, in Kenya, we have the 43 county governments, and here in Germany, there is different states. So how they are trying to discuss all this topic together, it's sort of like difficult to manage at national level, because in Kenyan side, it's more like the task for the Ministry of Health, like we have other ministries that are involved that are aligned towards tackling this climate change and health issues that we found sort of similar. And I think maybe Anka can add more on that, and then I can also talk more on the differences later after she's added a point. Thanks.
Sure, of course. Thank you so much. That's a great question, and it's a question that I was knowing to get. So, I mean, obviously, as stated in the question, the health systems are so different that you can't really compare those two, and that was also not what we were aiming to do. But a few things I found super interesting, and probably they're not surprising, but one similarity that we really found was the policy coherence that we talked about already across all sectors was a bit lacking in both cases. So meaning that the policies and actors in the different sectors were not really sufficiently aligned and linked with each other. And I think even though we looked from a really health sector angle or perspective on it, that's something that we really found. I think another thing, and Melvine was mentioning it before, that we really saw when assessing the governance structures was that the perception of those varied sometimes greatly between non-state and state actors, because we had both included into our expert groups that we used for piloting in the different countries. And that was something that is probably also not surprising, but just interesting to see within the results. And another thing was because we also had an indicator assessing transparency of and participation in governmental processes. I think it was more the case that there was a lack in Kenya, but we also saw in Germany when conducting the situation analysis that it was sometimes really hard to get information on, for example, interministerial working groups, on protocols, and sometimes there were not even any information to be found. So that was maybe as a last point to add from my side.
Mm-hmm. Yeah, very interesting. I mean, some of it does make sense because it's such a huge area and it crosses different kind of sectors that tend to be quite sort of siloed in a way. but yeah, interesting to see the differences as well. A couple of questions have come in about the kind of connection between the international level, climate policy level, and the national or local level. So I'll read out the one here. I was wondering if you have any insights into how global governance issues and processes, both in the climate and environmental realm and global health, for example, with the ongoing negotiations on the pandemic treaty, are reflected and discussed in local governance structures and discussions in the cases you investigated.
Maybe I can start from a methodological point of view and then hand over. Unfortunately, the indicator on the international commitment to climate change and health did not make it to the final round. There are many reasons for this, but I think overall also there are a lot of great initiatives already assessing this in detail. For example, the Lancet Countdown, but also others. And therefore, we did not include this. Nevertheless, at least in the rounds where I participated, I was able to hear these discussions coming up. But maybe I can hand over to Anka and Melvine to give a more precise insight from the countries, how they were reflected there.
Totally agree with you in case of the German workshops. Nevertheless, we really included more national experts, and I mean the national and the international cooperation to the topic are two very, at least in Germany, two very different streams, and it was also a matter of capacity and a matter of discussion time, because we really realized that even though just focusing on the national level, we took a lot of resources from the experts that participated, thankfully, and it would have been just a more broader and bigger discussion that we couldn't handle at that point.
Yeah, and just to add is that when we were looking into the vulnerabilities in climate adaptation, some of the participants from the Kenyan side were able to identify that there is also need for strengthening climate resilience through establishing these local networks, because you find out that, for instance, in the Kenyan setting, the shared landscape and climate priorities are completely different. As I mentioned earlier, we have like the semi-arid, the arid, the highlands, and also the coastal areas, and they all face different climate change situation. And also in terms of when you look into the natural resource management, like we have the Lake Victoria Basin, we have the forest and all. So you find out that there was some differences, as in some suggestions that really came out strongly. And now, if we also just look into the healthcare system, how it differs also from both Germany and Kenya, it was really a big difference. So handling this all together was quite intense for the participants who were there, and thanks to them for their shared input that we'll also highlight in our policy brief.
Yeah, absolutely. And I can imagine that was probably also took quite some work to get the input from them, get them all together in the workshops. Just because you mentioned this a few times, obviously you looked at both climate mitigation and adaptation. And I mean, I had the pleasure of already reading your evidence report on Germany. And my impression was that maybe there was a bit of a difference in how much health was integrated in the governance structures on climate adaptation versus climate mitigation. Was that your finding overall, or was that just my reading into some of this?
At least for the German part, I can fully agree with you. We really saw that for adaptation measures, it was much more included, the health sphere. Especially, I mean, we have the topic of heat, which was in the German context, a topic that really, where it is dynamic and where people are moving. And this being a part of adaptation, I think made it, easier to really include health there. But in the mitigation sphere, at least in Germany, there's much more to tackle and way more gaps that we saw when conducting the situation analysis. And maybe you want to add for the Kenyan side.
Yeah, thank you so much. For the Kenyan side, I would like to say the Ministry of Health really brings in partners and also the stakeholders where they develop actions on climate change and health. But when you talk about the the adaptation side of climate change and the roadmaps and regulations, we realize that there have been an active technical working group that has regular exchange meetings to discuss this ongoing, but the approach was for them to use what is already there and then expand to the whole society, which again drives us back to funding situation, because there is a lot of funding that are needed for climate change adaptation, and also just finding a balance between the academia, science, and also local communities were really needed to be created in this point.
Yeah, so in the practical aspect, yeah.
Yeah.
Karin, yeah.
Yeah, I just wanted to briefly add, in another work package of our funnel project, we did a scoping review on measures executed by public health institutes on climate change and health. And also there we saw this tendency that it's a strong focus on adaptation. Nevertheless, I think it really it's not so surprising also with regards to the focus we have. If we would look more into the environmental the measures executed by environmental actors, I think we could get another different picture. Would be, again, as a researcher, I can say what I find everything interesting, but it would really be an interesting second approach to have a look at the environmental side, see what they do and see how much health is reflected there, even though it's not executed by the health sector.
Yeah, that's an interesting point as well. We have a few more questions, so it's your almost last chance to raise your hand to get involved in the discussion or to put your question in the chat. Please feel free to do so. I wanted to also ask you about kind of like some of the main hurdles and challenges of assessing governance structures. You've talked about this a little bit, about the difficulty to get transparency in the processes, to maybe access some of the information as well. What other kind of hurdles or challenges did you find? And maybe other people who may also do research in this area or are interested in this area, how would you advise them to kind of deal with these? Karin, maybe you want to start?
Yeah, trying to, maybe I start with two and then hand over. Yes, I think a long list. I think Anka said it before, it's assessing governance structures can sometimes seem to be very fluffy. So it's nothing that can be measured easily in quantitative terms. And I'm always careful if someone shows me numbers of government structure assessments, because I think it's really also a lot about the qualitative process. And I think for this, our iterative process was very helpful, so that we always discuss this, try to put it into context, adapt it, and so on. And we also, when we collected our data, we did not only, so we did these steps, as you've seen, which seem to be very quantitative, but we also try to gather the qualitative perspectives from the experts. And I think that is something that I would always recommend if you have the resources and also the position to do so. I understand that not everyone is able to do so because of his or her position in this whole field. I think that's very important. I think the transparency was also something that surprised me a bit, that it was so difficult to obtain information, and that it was really, really difficult to get it. And I think that's something that we should work on. I think also living in democratic contexts, that we should have information to these processes if they take place. But I think climate change and health is such a rapid evolving and changing sphere, that this is also a barrier to transparent information availability, and also because things change a lot. For example, also in the German public health landscape just right now, it's really, really difficult to keep all of this up to date. Maybe I start here and then over to the colleagues.
Melvine, do you want to go next, maybe?
Yeah, for us, some of the hurdles that we also experienced was that during our exercise, during the workshop process, we realized that there was a missing link between also the governance frameworks and policies, and also the community implementation, because we realize that the strategies on government structure have been developed, but getting the tangible information on the implementation side, especially, was quite challenging. Even the stakeholders were like, I think there is need for pushing for this, especially from the Kenyan side, because there's a lot of policy briefs out there and structures and all that, but now narrowing down like what, let's say, for example, in Eldoret, where it covers the Uasin Gishu County, like what is happening there, and then we compare with Nairobi County, for example, there was no clear information on this. So I think through Phoning Project, it was an eye-opener for the participants or the stakeholders who are involved to maybe push forward for that from their organizations that they came from. Thanks.
That's a really good takeaway, yes. Yeah. Anke, do you have some of your long list of hurdles and obstacles that you had to deal with?
Yeah, I have a few to add. So maybe firstly, and Karin mentioned it a little bit already, so the field is rapidly evolving, and it's super hard to really get all the information up to date, and also as climate change and health governance implied as a term, it's an intersectoral policy field, and it's quite hard to always narrow the whole thing, and that, I mean, in the end, we had a really strong health sector focus, and we knew that, and there were always like people asking why it is so, and you always have to like explain and decide again whether you want to include more intersectoral factors or not. And we, of course, know and acknowledge that it's a super important part to also be assessed, but we were just limited into in terms of resources and time. And it's just a huge work package. And I mean, we only explored one of the building block components of the climate resilient WHO health system framework, and there are 9 more that could be explored. And another thing that was quite challenging, even though we had great experts that participated in the process, but and I mentioned it before, it took a lot of resources from the experts, and we really realized, because we had planned to have it as a full day workshop, but that was actually not enough to really get through the whole process, to really discuss and see, get into the evidence, and also assess. And in Kenya, we had the special situations that there were the floods. We actually were trying or planning on doing it in person, but it didn't work out in the end. So yeah, so a lot of also organizational hurdles. And I might come to an end because I see time is running.
Yeah, I can tell there would be a lot more to talk about, but I think very interesting insights and lots of interesting takeaways. And I guess also, I mean, you've come to sort of some of the milestones now, but the project is not quite finished, so there's still quite a bit more to come. And I think my colleague Lena has already posted in the chat the link to our newsletter, where we will also include the evidence report and the other publications that were mentioned when they come out, and where you can also obviously receive the recording from this Planetary Health Dialogue. And she just posted in the chat also a link to the other Planetary Health Dialogues that we've already had in the past, and that you can watch in your own time, and that are all on our website. I feel like this hour has gone by very quickly, and it's such a big topic, and we could only kind of like scrap the surface a bit, but still I found it really, really interesting to hear about your project and how you've dealt with all these difficult challenges to really make sense of this very difficult topic that is so relevant, I think, for governance structures widely. And yeah, I'm really looking forward to reading your other publications once they come out. And I thank you all for participating, and hope you have a lovely afternoon.